learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons, but the lessons I've learned after so many Ebola outbreaks in my career are be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
When a person is intubated, they're on a ventilator, 80% of the people will never come off the ventilator or thereabouts. Well, when is this over? I say, personal opinion, it's over when we have a vaccine. It's over when people know I'm 100% safe and I don't have to worry about this. When does that happen? When we have a vaccine.
Good morning, everyone. How you doing? Good morning. Ready for another morning. Our site in Stamford starts right now. Our site in Stratford is going to start at 9 o'clock today, so I'm going to do training up there in Stratford. We have both ends of the county. Set up and running. This afternoon we'll be in Darien. A shout out to the team in New Canaan as they work through the results. Shame on you to question LabCorp. Your informatics systems stink, so we've been working really hard to get that interface fixed. We will, I promise, as soon as LabCorp and Quest get their IT people to work 24/7 like our team at coronatestct.com is. Just that simple. Okay? I want everyone to be safe today. We have over 140,000 cases reported in the United States. We are going to have probably 250,000 cases reported very soon. Thank you so much. I'm just doing my part, ma'am. We're gonna have probably 250,000 cases soon, so we need to be prepared for that. We need to not be scared by that. If we test, treat, isolate, and trace, we're going to be able to put everyone where they need to be, to put everyone in their place, to keep them safe and secure. For all of my brothers and sisters working ICUs, makeshift vent centers, makeshift dialysis centers, stay strong and ask for your PPE. Don't settle for anything but get your PPE. These hospital systems have had great profits. They should have PPE. If they don't, you need to let them know that they need PPE, and that was a leadership failure that needs to change after this is all done. Okay? It's a leadership failure that needs to change after this is all done. All right? It doesn't usually start with back pain. I got a question about that. It doesn't usually start with back pain. People often report myalgia. We have well over 100 patients positive now, well over 100 patients that we are managing actively at coronatestct.com with the Murphy Medical Associates team. Fevers, myalgias, sometimes cough, A little bit sporadic stuff. The super spreaders often don't have any symptoms. Sometimes they have anosmia, which we've seen before as well, but usually not back pain to begin with. I have seen maybe 2 cases personally like that, where they felt they had quote unquote kidney pain, and with hydration that improved. But there's only a few cases. That's a small percentage. Most of the stuff is really systemic responses. Okay, I want to repeat my offer that I extended to the Departments of Health of New Haven, all the greater Haven areas. We're here to help you. To the private practices up there, we are here to help you. If you want to start drive-through centers, let us know. We are here to help you. Like I said, with the New Vance team, we gave them our business plan, our battle plan, so to speak, okay? We gave them how we operate, the cost to operate, all of those things, okay? I know. The call to Bloomfield again, I hear you. I have to get the manpower, okay? We're battling down here first. We will move back as we can, okay? We will move back as we can. We'll man that wall. Right now in one of our buildings, in fact, where the property manager kicked us out, the building manager has said, please, can you test me? So I'm going to do that this morning. I'm going to get some kits ready, and I'm going to head up to Stratford. All right, I want you all to be good to each other. Do your best and be good to each other. Be quick-witted and brave, okay? This is Dr. Murphy, Murphy Medical Associates, and coronatestct.com. coronatestct.com signing off. We love you guys. Have a great day. Stay safe. Good afternoon, everybody. I'm here at our site. In Stamford at Cummings Beach. I want to thank everyone for tuning in. I wanted to let you know that Mayor Martin made a big announcement letting him know that we are revving up our site capacity. We are working towards getting towards the weekends and having weekend availability, and we found solutions for the sample collection kit problem. That was a bottleneck. We managed to solve it. We found a couple of great things that are helping us out, including phosphate buffered saline. Okay, we're able to collect our samples not using the transport medium that we traditionally use. In addition, we're able to use a different type of swab that has polyester. Why? Because the Copan swabs that are used are made where? In Italy. Okay, they're made in Italy, so there's a severe shortage. We are using additional polyester swabs, the type of swabs you would see in rapid strep kits and rapid flu kits. All right, this is very useful for us. We want to thank orthopedic and neurosurgical specialists. They managed to answer the call and are delivering swabs for us. In addition, we want to thank Dr. Kathy Violi and her group. They managed to find 100 swabs for us that we're picking up today. We want to ask all of you, everyone who's got a practice who may not be using their swabs, please answer the call. coronatestct.com. coronatestct.com. We need your help. We need your support. We need your manpower. And I want to tell you about manpower. We have unleashed the medical students on the battlefield against this virus. They are answering your calls. They are here for telemedicine visits to help you, to screen you, to get you through the process. They're seeing our first calls. They're seeing our second calls. They're seeing our patients and helping them through this process while they wait for their test results. They come from the New York Medical College and the Toro College system. I want to thank all of them. They're all working hard today. You keep it up, medical students, okay? You keep it up. You're doing great. You're helping us all. You've answered the call. All right, so I'm going to let you go for the afternoon. I'm going to remind you that we need to test, treat, isolate, and trace. Great data coming out of Germany. Why? Because their public health system was able to test, treat, isolate, and trace. And we're going to continue that nonstop. Nothing can stop us. We will beat this virus, this invisible enemy. We are going to win this war together. I need you all to help in any way that you can. Doctors and doctors' offices, look for polyester swabs, Dacron swabs, anything that is not cotton or wooden. Please, we can use your donations. Answer the call. All right, this is Dr. Murphy from Murphy Medical Associates and our team here at coronatestct.com. coronatestct.com. Signing off, getting back to the line. Thank you guys. Have a great day. Good afternoon. Well, almost good afternoon, right? It's 11:53. I'm here at Westport near the Azena Nail Spa, which is shut down. Why did we close all the nail spas and hair salons? Because people were in close quarters and they could spread the virus. And in fact, they were in a high likelihood of spreading the virus. Okay? The novel coronavirus is 3 times as infectious as influenza. 3 times as infectious. So I want to give a little quick talk about testing. Let me tell you why. Because everyone says as soon as we can get tested, people can go back to work. Well, guess what? No, they can't. Okay? No, they can't. I am sorry. But if you are spilling and shedding virus from your nasal pharynx, you should not go back to work. Well, it's safe for you to work. Yeah, but it's not safe for the people who are not immune. It is not safe for the people who are not immune. In addition to that, it is not safe for people spilling virus to go to the grocery store. It is not safe for people spilling the virus to go to the pharmacy. The pharmacy and the grocery store cannot be responsible for sanitizing after every person walks by in the grocery store. There was this little silly game that was going on with youngsters and coughing on food and produce. It's not funny. It's a real life or death issue. So because of that, we cannot have people spilling virus going back to work. We just can't do it. Well, the antibody test, which is that 5-minute test, you prick your finger and you check, that does not tell you whether you are spilling virus or not. There's only one test telling whether you're spilling virus or not, and that is to look for the nucleic acid of the virus in your body, okay, from an area which it spills from. Where does it spill from? Your nasopharynx, your nose, and your mouth. That is the only test that you are going to be certain that someone is not spilling virus. I've taken care of well over 100 of these patients right now, and I do telemedicines every night between the hours of 7 until sometimes midnight, seeing patients. I have seen patients relapse and remit. Okay, what does that mean? It gets better, it gets worse, it gets better again. But you know what happens? They spill the virus. How do I know? Because we make them test again. When they're feeling good for 72 hours, we test them again. We test their nasopharynx again. Of all the patients that we've tested again, only one has broken quarantine. That is 2 negative nasopharyngeal samples within 24 hours. That is my decision to break quarantine, and that's what our patients are doing. I know a lot of places that are being much more lax. That is not going to help flatten the curve. Blood tests, 5-minute test, whatever your test is, if you are not testing whether you are spilling virus or not, then you are not doing the public health service by keeping patients that are spilling virus from the public. All right? China was so serious about this that they literally welded people into their doors, into their homes. China rounded up people in colonies to keep people who had the virus from spreading it. That's not America. We ask you to do this. We ask you to stay quarantined. I'm hopeful for the new test. I think they're going to be useful to identify who is immune, but I don't think it does a public health service letting people who are spilling the virus out in the public. That just doesn't make sense. So, in 2 weeks, we will offer the antibody test. In 2 weeks, we will offer the antibody test through our drive-thrus. We will do that for people who maybe were sick and got over it. We'll check their antibodies to see if they're immune. We'll also check to make sure they're not spilling virus with a nasopharyngeal swab. Okay? We want to protect the public by testing, by treating, by isolating, and by tracing. If you're shedding virus, you should not be out in the public. End of story. You should stay home. You should recuperate. If you're shedding virus, you need to focus your efforts on yourself. End of story. We're here to help you. We're coronatestct.com. As I said before, we've engaged multiple departments of health. We continue to work with them. We had a successful morning here at Westport. We continue to run with the Stanford City, okay, with the city of Stanford. We're running there now. We'll run there till 4 o'clock today. Mayor Martin has expanded our capabilities, and we should get some new recruits very soon. Our medical students continue to triage our patients. Our team works hard and does telemedicine visits every day to follow up patients to make sure they don't get lost in the shuffle. That's the key. So I don't want to poo-poo on at-home tests or any of these sorts of things. The most important thing that we know and we have to detect is whether a patient is shedding the virus or not. If you're not shedding the virus, 2 negative tests within 24 hours, you're safe to go out. You're protecting the public. But if you are shedding the virus, you should not be out in public. I'm sorry. I love you guys. That's just the way it is. That's the safest way for public health. All right? This is Dr. Murphy with coronatestct.com. That's coronatestct.com, reporting from the Barnes & Noble bookseller and Azena Nail Spa here in Westport. All right? Have a good day. Stay safe. Be good to each other. Remember, we're all in this together. Every one of us can do something to contribute to flatten this curve. All right. Have a good day. Bye. Good evening, everybody. I know it's awfully late. I just finished with my telemedicines for the day. Just finished with my telemedicine visits for the day, talking to a bunch of patients in Dr. Murphy's Corona Club. What's my Corona Club? It is all of the positive patients that we have with novel coronavirus. We are well over 100 patients now, and we are actively monitoring them on a daily basis. Why do we monitor them daily? So that way no one gets lost in the shuffle. You know, we've had a couple of patients enter our club that weren't even tested by us. Hi, how are you doing? Listen, I wanted to tell you that if you want us to come to Bloomfield, you need to go talk to your DPH. And all of the people who watch, I want to tell you, if you want us to bring Corona Test CT to your community, the best way to do it is to call your local Department of Public Health and have them reach out to us. We find that the public-private collaborations are the best, right? So working with local towns and their departments of public health, that's the best way to do it. So reach out to your Department of Public Health, have them give us a call. We're actively working on our lab testing. And as an aside, I just want to go back to the Corona Club. So yeah, we had a really nice physician assistant patient who was tested at another facility because she was an employee, but kind of got lost in the shuffle, you know, and sometimes that happens, especially if you're not followed by your physician with this case. And it's okay. We have lots of physicians who have asked us to follow up their patients and kind of give them updates and reports as we go through this case, since we have quite a few patients we're testing. So I want to talk about the Corona Club and why we do it. We do it because we want to detect early. I think I told all of my volunteers, the medical students, and the local MRCs that have been called up, Murphy Medical, one of the symbols in our crest is a lighthouse. The lighthouse is the early warning symbol. And one of the best ways to test, treat, isolate, and trace is to get a good community map of what's going on. The only way to do that is to test, right? You have to test or you can't do the rest. So we are very, 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 very focused on testing. And we're really working with communities to get testing out there. And we believe the best way to do this is through drive-thrus. I want to talk for a second about this poor little baby that just passed. You know, one of the problems I found is that when you apply restrictive criteria to your testing, you miss cases. And you miss 100% of the shots that you don't take. You miss 100% of the putts that don't get to the hole. You have to take your shot. And in this case, you have to test. And so telling a mom and their child that they don't quite meet criteria, that just doesn't make the grade. That doesn't make the grade. You know, we know symptoms are all over the place around here, whether they're cough, sneeze, anosmia, dysgeusia, all these symptoms, runny nose, fevers, back pain, myalgias, chest pain, it's all over the place. So the only way to know is to truly test. Now, what I found out is a lot of the system-based healthcare entities, hospital systems, they have pretty tight rules in place. I think I said the last time that New Vance and Norwalk and Danbury tend to have a little lighter rules. And that, you know, part of that reason is I had extensive discussions with them multiple times and gave them our playbook and our risk stratification protocols. And they're really following our playbook and they're doing a great job in Norwalk. So I want to commend New Vance Health for doing that. But there are some other health organizations who have really restrictive criteria. And restrictive criteria leads to misdiagnoses, as is the case here with this little baby. Now, we don't know all the medical information about this poor 6-week-old child, but we do know that the child had coronavirus. Now, that's a 6-week-old. Where does a 6-week-old get coronavirus? Could get it in the hospital, could get it in the pediatric office. They could get it from their parents. You just don't know unless you test. You don't know until you test. Unfortunately, the youngest of us and the oldest of us are very increased risk. That being said, those of us who are overweight, you're right, they aren't testing everyone. And the South Korean model is pretty crystal clear. Test everyone. And not just the immunoglobulin test, because that's a good test. It's not a great test. It doesn't tell you truly whether you're immune or not. But it's a reasonable test to know whether you've had it in your body. Testing nasopharyngeal swabs and looking for leaking of the virus and shedding of the virus, that's really the gold standard. And so I want to encourage you, right, in Bloomfield or in Madison or in Southbury or in Meriden or wherever you are in private practice, areas where there aren't big hospitals or maybe where the hospitals are restrictively testing, go to the departments of public health. And, you know, if you've been getting headaches, go to your doctor, talk to your doctor. If they won't test you, reach out to your departments of public health and demand that they put together a program. We're working with a ton of departments of public health this way, a ton of them at coronatestct.com. So I want to encourage you, if you want a drive-through service in your town, go to your Department of Public Health. Have them reach out to coronatestct.com. We have the playbook. We can help them set it up. We've done it in Darien and in New Canaan and in Westport. We've done it in Stamford. We've done it in Stratford. And in Stratford, we've had excellent results with a great MRC showing up. So I know there are a ton of towns in Connecticut that will answer the call, but you have to work with your departments of public health, work with your towns. We'll be happy to help them set it up. You can come see us at coronatestct.com. Right? I know where Bloomfield is, and I know Hartford County. And we've reached out to a few different places, but they've got to get some manpower. All right? It's a real shame about what happened with this little child, and I feel awful about it. I feel absolutely awful. And who knows, could we have saved this little child or not with early detection? I don't know. I can't Monday morning quarterback. All that I know is if that child was detected earlier, you could have watched him earlier, right? Most little babies die from lack of oxygen, right? Dehydration and oxygen are what kill the most vulnerable among us. And maybe they could have helped. Maybe they could have given positive pressure. There could have been a lot of different things they could have done. But we can't shoulda, woulda, coulda. We have to feel bad, be with the family, say our prayers, and test, treat, isolate, and trace. If you don't test, you can't do the rest. That's what we do at coronatestct.com. We test, we treat, and we isolate, and we help departments of public health trace. So reach out to your departments of public health, ask them to partner with us in a public-private collaboration where we bring testing to your town. This is Dr. Murphy. I'm signing off. I just finished on the elliptical, right? If you're home and cooped up, I want you to exercise. It's very, very, very important. Very important. Back pain and no other symptoms, watch for fevers, talk to your doctor, okay? Can sort it out. It's spreading. It's in all the counties. It's moving up the interstates. We need to act and be proactive, not reactive. The problem in New York right now is directly related to reactive relationships. We can fix this in Connecticut. We can flatten the curve, but we have to be proactive, have to answer the call. I'm going to bed, and I hope you go to bed too, because guess what? It's very important. Tomorrow's another day. You got to get your rest. Get your rest quarantined, okay? Keep your immune system high. This is Dr. Murphy with Murphy Medical Associates and our services at coronatestct.com. That's coronatestct.com, where our drive-thrus are testing, treating, isolating, and tracing with our medical students, with our staff, with our MRC volunteers. We're here for you. Have a good night. Get some rest. Love you guys. Night-night.
Good morning, everyone. Good morning. I don't know if you can see it, but it's going to be a rough day today. All right, we're out here at the site. The tent blew over. We have men working on it, but it's going to be a dangerous day. It's going to be full of wind and full of rain. These days are risky days for our people. So I want to tell all of you to stay inside and stay safe. The wind and the rain are no place to be driving around in unless you're absolutely certain you need a test. Okay? Us at coronatestct.com, we're going to be out in this rain. We're going to be out testing, treating, isolating, and tracing. We hope you guys stay inside and stay warm. Stay safe. Okay? We can use all the help that you got. Friends and family, donations of your time or efforts. We're starting to run on our PPE. We need your help at coronatestct.com. We need your help at coronatestct.com. That's coronatestct.com. We're out here in the rain. We're going to be doing testing at our site. Our tent blew down. We're putting it back up for our people, for everyone. We're going to test, treat, isolate, and trace. I'm going to let you guys go now. Have a good one, okay? Stay home and stay warm. Good morning. Good morning, everybody. I wanted to share this with you. Can you see it? That's the beach. And what I love about the beach, good morning. What I love about the beach is its calming nature, but its powerful nature at the same time. It's so important that we respect nature. And in this case, we need to remember viruses are nature. We have innate nature too. Our immune system can work to help beat this virus. Okay, but it needs a little help. It needs a little help from the lifeguards.
We need a little help from the lifeguards. So as we begin our weekend journey here at coronatestct.com, our weekend journey, we are standing up troops from the MRC of the city of Stamford. These troops will begin to run our weekend coronatestct.com testing service through Murphy Medical Associates, and I can't be more proud of them. You know, it brings me back to listening to Hamilton. I don't know how many of you used to listen to Hamilton or the soundtrack or whoever had the bundle of money to go see the tickets. You know, I got to tell you, that would be really awesome maybe if some of these Broadway teams would start to put together their shows live stream on Zoom or however. It would be fantastic. I know our team here at coronatestct.com would love that. We are young, we are scrappy, and we are not going to throw away our shot to flatten this curve. We need all of you together. Help us flatten the curve. Answer the call. We are all here. I want to make a special call and a special plea out to all of my healthcare practitioners that are short of PPE, that are scared of going into the battlefield. Do not be scared, be brave. Use what you can. And if anyone who is not your brethren, not your brothers or sisters, not those who have trained as a nurse or a doctor or a PA or an LPN or a nurse practitioner, if anyone who is not clinically trained is pushing you to do something you're not comfortable with, rise up, stand up, go to your brothers and sisters, ask for their support. Now is not the time to enter tribalism. We must stand together, protect each other in the battlefield trenches, protect each other, be good to each other. We protect our own. I'm going to sign off for the morning here with just a beautiful view of the beach. I hope you guys enjoy it. Just take a couple of seconds to soak in some peace before the weekend battles begin. This is Dr. Murphy with Murphy Medical Associates and Corona Test CT getting ready to sign off. I stand ready to help all counties in Connecticut rise up, test, treat, isolate, and trace. We will move to Hartford as soon as we can, Linda. I promise. Now let's just enjoy a couple more seconds of the waves at the beach. Be well, my brothers and sisters. We love you all. We miss you all. Be safe. And we'll see you soon. This is Dr. Murphy with coronatestct.com. That's coronatestct.com. Signing off for the morning. Have a great, great weekend. All right, good evening. Whoa, that hair is wild. Sorry about that. Good evening, everybody. I wanted to touch base with you before we head into tomorrow and our drive-through testing at coronatestct.com and in the city of Stamford at Cummings Beach. I want to talk to you a little bit about payments, right, and how the system you will get cared for. And as the president and in our state of Connecticut, Governor Lamont said, testing and the care from testing will be covered, right? It will be no cost to you. Well, I'm here to tell you right now, currently there's an insurance company, well, multiple insurance companies, but I'm going to pick on one in particular because it's in Connecticut. That is Aetna. Aetna became bought by CVS where they created a vertical healthcare system where the pharmacy and the pharmacy benefits manager merges with the insurance provider, and now with CVS Minute Clinics, with the care providers. So it's a vertical system. The problem is that vertical system also pays lots of other different healthcare practitioners. So when CVS bought their pharmacy benefits manager, they cut the payments to the mom and pop pharmacies. Here's what happened. They all went out of business and they got bought by CVS. That's why CVS are everywhere in the state. It's a big problem because it's a monopoly. Now the federal government allowed CVS to buy Aetna. What do you think is going to happen? The exact same thing. Well, they said, no, we're not going to do that. Well, let me tell you the type of shenanigans going on at Aetna. Despite what the president said, and despite what the governor said, Aetna is continuing to charge patients and pass along the costs for coronavirus care. They're passing along costs for testing. They're passing along costs for the telemedicine visits we have when we check in with the patients to make sure they don't need to go to the hospital. They're passing those costs to you, the subscriber, the client, the whatever you want to call it. In my words, they're passing along the cost to the patient, and they're putting the patient's financial health at risk. All right, this is not a good thing. Many of these other insurers are playing very similar games, requesting chart audits, trying to prove that you saw a patient in an emergency in a drive-thru, right? So, fine. These are the games they want to play. They are not good members of the health system. Fortunately, during this pandemic crisis, we've also seen a lot of other bad actors in the health system. One of those I can think of is a situation where certain administrators were preventing healthcare workers like myself from wearing masks in the hallways. Okay? So I'm calling out Aetna today because you're acting just like those administrators that wouldn't let us wear masks in the hallways to protect ourselves. You're putting the patient's financial health at risk. It's not okay. I will go to the state attorney general. I know the Connecticut State Attorney General, and I have no problem reaching out to him. Aetna, if you want to claim this is an algorithm thing, you're wrong. I have claims that prove you paid and claims that prove you didn't. I believe you have an algorithm that runs about 10 to 20% of your claims with these sort of shenanigans. You need to shut off those algorithms right away. I'll take this all the way to the top. I don't care. That's my word. Murphy, Dr. Stephen Murphy, with Murphy Medical Associates and coronatestct.com. You got my word, Aetna. I'm coming for you. You better do the right thing. You better take care of all of those healthcare practitioners that are putting their lives on the line to take care of your clients. Why? Because they're our patients, not yours. You better start doing the right thing. Your fiduciary risk may not be just to your shareholders, but to the people that entrusted you to pay for these costs. The president said it. Governor Lamont said it. I'm going to go to Attorney General Tong if you don't quit it. Fix your algorithms right now. Fix them right now. Your denials, your claims audits, your deductibles and your co-pays that you're passing along, the co-insurance to the patients for coronavirus testing. The president and the governor said you can't do that, yet you still are. You need to wake up. If you want to have a vertical monopoly, you need to be the best person in the room. Right now, you're not acting that way, Aetna. This is Dr. Stephen A.R. Murphy with Murphy Medical Associates and coronatestct.com with your friendly public service announcement that insurance companies are playing games and refusing to pay for the things that the president and the governor said they would. All right, have a good Saturday night. I love you guys. You can visit us at coronatestct.com. That's coronatestct.com. We're here for you. We're going to take care of you, and we're going to hold insurance companies accountable.
Buenos días, mi familia. ¿Cómo está? Bien.
¿Cómo está? Bien. Oiga, mi gente, estamos creciendo. Estamos creciendo. Si tú necesitas algo prueba, quizás algo prueba de coronavirus. Podemos hacerlos, okay? I bet you didn't know that, right? We speak Spanish. We can help our Spanish population. We have a call center in Colombia. And if you need something, if you need it, buenos días, linda. Right? Good morning. If you need something from our team and you don't speak English, we can help at coronatestct.com. That's coronatestct.com. We can help you. Our call center in Colombia can help you. Our nurses and our doctors up here can help you. There are many languages we speak because we're all in this together. This is the human struggle. Okay? Estamos juntos. We are all together. Y si se puede. We will get through this. We will win. We will flatten the curve. We will test, treat, isolate, and trace. With the departments of health, we will find good partners in good towns, in good counties. We will work together. We will help them all survive this. All of the citizens of Connecticut, we will get through this. I promise. Juntos. All right? I'm here at Stanford. I'm headed to Stratford. We're going to go across county. We're going to see how they're doing there. We're open now, coronatestct.com and Vivo in Stanford. And we will soon be ready to go in Stratford at around 9 o'clock in the morning. Okay? Los amo. Be good. You take care of yourselves. Linda, listen, if you need telemedicine visits, just go to coronatestct.com. You can register there. You don't need to be tested by us. You can just register and be a patient. You can get telemedicine visits from our team. We do all sorts of stuff, right? That's why we're a medical practice, Murphy Medical Associates. We do all sorts of things, all right? Si tú necesitas una cita, just register online, okay? Just register online if you need an appointment. We can do telemedicine visits for all sorts of things, all right? You can go there, coronatestct.com. We'll take care of you. Have a great Monday. It's another week to fight the fight. We're here for you. We're here with you. We'll do it. We'll get through this. Victory is ours. All right? Love you guys. coronatestct.com. That's coronatestct.com. Nos vemos. Hasta luego. Morning, everybody. I wanted to introduce you to our ultrasound and cardiovascular suite. Why do I want to do this? Because I'm working out how to get ultrasound services out of our office, right? So we have portable ultrasound machines. I want to talk to you guys for a couple of seconds. All right. So one of the things that we notice with this virus is people are getting increased clots, right? So increased thrombosis, clots, and having something called myocarditis, right? Myocarditis is where your heart swells and inflames and doesn't pump very well. In addition to this, there are a small percentage of cases that have what we call SCD, sudden cardiac death. And so in the hospital, we know this. We're actively treating the patients with anticoagulation. In the outpatient world, not so much. Now, at coronatestct.com, we do telemedicine visits with our positives, but there are a whole lot of other people who had tested positive that are not getting regular telemedicine visits. And so it's important, and I want to tell everyone, you can come and get telemedicine visits with us. We can manage you. We're following the literature properly. If your doctor is too busy to follow up or to track these things, or if you don't even have a doctor, but managed to get one of your buddies to order you the COVID test and you're positive, you can come over to coronatestct.com. You can register with us. You can be a patient with us. We'll set you up right away. You can email message us and those things too. Good evening, everybody. I know it's super late. It is definitely late. It's time to go to bed, but I have to talk to you for a couple of seconds. You know, me and our team have been doing drive-through coronavirus testing for over a month now, trying to take care of all of the patients, to bend the curve, so to speak, and to, how's it going, and to test, treat, isolate, and trace. That was our mandate from the World Health Organization. That was our mandate from the CDC. And it was our mandate from our governmental entities. And they believed in it so much that Governor Lamont issued an executive order. The president issued an executive order saying these physicians, these frontline workers, these healthcare workers are doing the work for society and they need to be paid. And when those orders came through, I actually felt a little bit better, because these insurance companies over the last few years have really broken the chain of trust, right? What's insurance? You pay for insurance in your time of greatest need, right? The trust is there. You pay them, they'll pay you back, all right? But unfortunately, insurance and insurance companies are broken. They are the weakest chain in society right now. And they currently are breaking the trust. Sorry about that. I got a phone call from LabCorp telling me about more positive cases. All right, guys, how are you doing? I saw Senator Duff on here. Oh, I love that guy. You have no clue. Hopefully he'll come back on. We'll see. I invited him back on. Hopefully he'll watch, right? That guy is awesome. You guys have no clue how awesome Senator Duff is. So I got cut, right? My line got cut. I don't know what happened. You know what happened is the labs were calling me. They had a bunch of positive coronavirus tests that they had to tell me about. So I want to go back a little bit to this social compact, the social contract that we have with insurance companies, right? The contract that we have is the following: we pay you money, and you're there for us in the time of need. And right now we have a massive need, right? We need to protect each other and be in this together, right? We need to do whatever it takes to make sure that the people on the front lines have what they need. One of those things they need is capital, money, to be able to care for the patients. And our current funding system is through insurance companies and federal and state-funded governmental agencies. And right now, the private companies are breaking the chain of trust. They're breaking the chain of trust. And what's that chain? I pay you money for my car. If someone runs into my car, it's going to cost money to pay for it. I don't have that much money right away. And so I pay into the insurance company to pay for this. The insurance company is supposed to be a good steward of that money and then pay it out as the claim goes. Now, with insurance companies, they pay every day. So they know they're going to have to spend money every day. Well, how about a global pandemic? Well, yeah, you're going to have to spend a little bit of money. Unfortunately, what they're doing is they're not spending that money. They're making the patients pay by passing it along to deductibles. So I'm going to let you go for the night, but I'm going to tell you the following thing. Insurance companies are not upholding their end of the bargain with the social contract, which allows insurance companies to get most favored nation status. They're not paying claims, and they're passing the costs on to patients, which is a direct violation of the executive order from the governor. I'm not going to stand for it. I'm going to go directly to the governor if I need to. All right. I hope you guys have a great night. We're going to stand up for you, the patient, because you made a contract with society and with insurance companies or with the state or the federal government. End of story. This care should be paid for. It should not cost you anything. And I will make sure that happens. This is Dr. Murphy with Murphy Medical Associates and coronatestct.com. That's coronatestct.com signing off. Get some sleep. Tomorrow's another day. Take care. Hey guys, what's going on? Happy afternoon. Happy afternoon. I wanted to touch base with you guys and let you know that we're doing some great things. This week, I'm focused on solidifying services for the patients that are a novel coronavirus positive. Unfortunately, there's a stigma going around right now, and that stigma is not very good. That stigma includes getting angry at people that have novel coronavirus infections. And what I think we need to understand is people are going to be positive, and they're going to need to be cared for, and they're going to need to be able to get the care that everyone else has. In addition, people who are not infected, and we don't know their immune status, deserve to be protected from infection. So I think until we can truly find out who's immune and who has a vaccine, we need to take care of these patients in very unique ways. I think we have to be very creative, and I think we need to think about how the safest way for that to happen is. I think as the weather gets better here in the Northeast, we can start to develop open air clinics, right? I think we can establish open air clinics for the positive coronavirus patients. If we maintain social distancing and we maintain isolated private services, I think with a 27-foot radius, we can safely say that patient is free from giving this to other patients. I think we should have novel coronavirus clinics that are for people who have tested positive, who need services. I can tell you now we have hundreds of positive patients that we're managing, and they present with chest pain. They need an echocardiogram. Where are they going to get this? They need an EKG. Where are they going to get this? Well, right now, they're flooding emergency departments. They don't need the emergency room. Emergent patients need emergency rooms. And these emergency room doctors are working so hard. They're working so hard. And the hospitalists and the internists and the doctors that are taking the residents and everyone that are taking care of patients in the hospital, they need to have a little pressure relief, right? They need a pressure valve here. And I'm going to try and create that pressure valve in our little zone in Fairfield County. I believe we can create safe, open air clinics for coronavirus positive patients, and I'm going to work on that. In addition to that, I commit to working for patients who don't have coronavirus too, and we'll be able to take care of them in a safe way. Currently, we're doing telemedicine for those patients, but they also are going to need services. They're also going to need the restarting of the rest of our medical system. And so I'm working on that too. And I hope that you'll join me in answering the call. We'll need volunteers. We'll need people who want to start practicing again. Reach out to me, coronatestct.com. We're going to put a lot of doctors back to work on the front lines, making sure that these patients that have coronavirus don't have heart disease, aren't at risk for sudden cardiac death, that they don't have clots in their leg. We're going to protect them, okay? That's our job at coronatestct.com. It's not just testing, treating, isolating, and tracing. It's continuing the care for these patients. I hope you'll all join me. Our website will have some updates for it. I've reached out to several communities. We're going to start testing and drive-thrus in communities we haven't before that desperately need it. We're here for you. All of the departments of public health. Come to me. We know what we're doing. We can help you stand up clinics. We can help you surveil in hotspots of communities. We're coronatestct.com, a part of Murphy Medical Associates, right? Come join our family. Be part of the family. We're going to help everyone, okay? Bit by bit, we can do it. We can. All together, because we're all in this together. Test, treat, isolate, and trace. If we can't test, we can't do the rest. All of these patients need to be tested. We're here and we're committed to it. Okay. Hope you guys have a great afternoon. My afternoon is full of bike riding. Okay. I'm going to get a little activity today. Everyone should get outdoors. Okay. Get outdoors.
All right. We love you guys. Have a good day. It's Dr. Murphy with Murphy Medical Associates and coronatestct.com. That's coronatestct.com. Have a great afternoon. Bye-bye.